infective endocarditis for UKMLA exam. The basics are it's an infection involving the endocardial surface of the heart. So I'm showing you here, this is the endocardium, and that surface is infected by bacteria. Staphylococcus aureus is the most common cause, followed by streptococcus, that you need to memorize. Now, it can affect the valve. Most commonly affected valve is the mitral valve, followed by the aortic valve. Risk factors are really important for you to, as a hint, to diagnose that this is a infective endocarditis. The sources of bacteremia could be coming from IV drug abusers. So recreational drug abuse and IV drug abusers as a big hint. Indwelling vascular catheters or invasive vascular procedures is also a very big hint that it could be infective endocarditis, or a recent dental work. So these are very, very important clues in the stem of the question. Other cardiac risk factors could be the patient has valvular disease or had a previous valve replacement. They have a structural congenital heart disease or a previous infective endocarditis, or they have hypertrophic cardiomyopathy. Knowing these risk factors is really, really important for you to have a clue that this could be this condition. Now, having risk factors by itself is not enough. You need to have these risk factors, and then if you have the clinical features, then you are more sure the answer is infective endocarditis. The clinical representation of this is very variable. So we need to know the main things and link it with the risk factor. So most commonly, patient will have fever, heart murmur, and systemic symptoms. So these will be given to you in the exam most likely. We have two, so this infective endocarditis could be acute, which develops in days to weeks, or subacute, so weeks to months. In 30%, there could be an emboli to the brain, to the lung, or to the spleen. If you go to the brain, it can cause stroke or a TIA. So if you see a patient with stroke symptoms and fever, then you're thinking, oh, could that be infective endocarditis? Very big hint. Fever and stroke or TIA symptoms. Some patient can have congestive heart failure as well. So these are the very, very important features that could be given in the exam, that for you to think, oh, you link it with the risk factors as well. Now, the other things would be like splinter hemorrhages. You can have Oslo node, which are tender, genuination, which are not tender, and Roth spot. Now, these, if a patient has these things, it does not mean that they have infective endocarditis. It could be other things. You have to associate it with these things like fever, heart murmur, and also with the risk factors. Very, very important. Management, you must do 3 sets of blood culture, very important, before to antibiotic therapy. Echocardiogram, and very important is you have to involve multidisciplinary evaluation, so from input from the cardiologist, from the microbiologist, and also from the heart surgeon.